The inauguration of President-elect Donald Trump just a few hours away, many people are wondering what the future of health care will look like and what it will mean for them.
Well, in this week's Ion Health Report, I head to a local clinic that's bracing for what could come their way. Leadership in Washington, the future of health care is up in the air, and that spells uncertainty for consumers and clinics like Volunteers in Medicine.
It is extremely unnerving, and it's so concerning to me, too. I've seen many different proposed plans.
Repealing it, they go a whole new can of worms, because last time, look how long it took.
But others who rely on the coverage say they're taking a wait-and-see approach.
The change, what is it going to be any different than what it is now? We don't know. So we're not secure with it the way it is now anyway.
If the Affordable Care Act is repealed without a plan to replace it, Americans face a tough reality. Up to 30 million people across the country will lose their health insurance. And a lot of those in our area will find themselves turning to places like Volunteers in Medicine, a clinic that provides free medical care to uninsured adults. Doctors and staff at Volunteers in Medicine sees about 500 patients a month, and they're bracing for an increase with the uncertainty surrounding the future of the Affordable Care Act. And that means an increased need for funding. Charity care clinics like VIM rely on donations from businesses, individuals, churches, and foundations to keep the doors open. There are still lots of questions about what a new plan would look like, what parts of Obamacare would stay and which parts would go.
We have an amazing group of volunteer doctors and nurses who work so hard out of the own goodness of their heart to come in and see patients and figure out the best and least expensive way to treat problems they've got.
And even though that may become a bit more challenging depending on what happens with the Affordable Health Care Act, Ashley says Volunteers in Medicine will continue doing what they can to keep those in our community healthy.